My interest in plastic surgery really was stimulated in those early years working in accident and emergency departments when I used to enjoy reconstructing faces and hands which had been damaged by trauma. And so then I went on to study plastic surgery. It's about a 6-year training period, and I spent several of those years in the United Kingdom. The reason patients choose to have aesthetic surgery is not, as is widely believed, because of vanity. A vain person is a person who seeks attention, who wants to be noticed, who wants to be beautiful. Overwhelmingly, the main reason that people ask for aesthetic surgery is because they want to look normal. We do a lot of breast surgery, such as breast enlargements and breast reductions, a lot of facial surgery, especially nose surgery, which is known as Rhinoplasty, and eyelid surgery, for example, and surgery to correct the aging process, such as facelift surgery. And also there's surgery all around the body, for example, on the tummy, tummy tuck operations, and liposuction in virtually any part of the body. Many procedures are being performed as day cases, that is with a patient going home the same day, rather than as an overnight stay or several overnight stays. What initially drove this was the cost saving. It was obviously less expensive to be in hospital only for one day and not stay overnight. But what we realised with time was that we could actually do these procedures more safely than in a hospital. In the eye of every patient, the surgery is necessary. No one is going to subject themselves to an operation and all the recovery and risk of complications for some trivial reason. For them, they've usually worried about it for many years, and it's usually a very specific problem, such as a very heavy bust, which is giving them neck ache and backache and shoulder pains. They have to wear loose clothes to conceal their deformity as they see it. And for them to be able to have a normal bust means they can go ahead and lead a normal life. A little boy of 7 who was teased in the playground because of his prominent ears. And he was really upset to go to school. And he was very keen to have surgery. And he understood that it was difficult for him coming into a little operating theatre and having to have an anaesthetic and having to wear a bandage. But he embraced this willingly because he wanted to feel normal about himself. Plastic surgeons often see themselves as psychiatrists with a knife, that we're operating not just on the body but on the soul.